Welcome to Life Sutras, where we have empowering conversations with thought leaders that will inspire you to be a healthier and happier version of yourself. We will explore science, the subconscious, as well as the spiritual. Good health equals harmony between many dimensions of mind, body, environment, and the unknown. Hi, I'm Aanchal Bhatia, author of Your Doctor is Not God and How to Be the CEO of Your Health. I believe that health is by choice, not by chance. I am a clinical psychologist by education and an entrepreneur by profession, and a social change agent by passion. I'm a wife and a mother of 2 boys. My husband and I are one formidable team, and that's how we founded Sydenham Clinic, a private health management clinic here in Houston. Welcome and let's explore. Welcome back to Life Sutras. Today we have a very special guest, as always. She is an entrepreneur, a physician, and a mom of 4 kids, Dr. Mary T. Bowden. Dr. Bowden has a brand new facility very close to us here at Sydenham Clinic. It's called BREATHemd, and she is an ENT physician. She's completed her residency at Stanford University. Yes, Stanford. So we have a very super smart doctor here today. She's board certified both in otolaryngology, which covers eyes, nose, and throat. She's also double board certified in sleep medicine. And her specialization, and I think her passion, is for sinus and sleep allergy disorders. As a mom of 4 boys, Mary spent many years on the other side of the doctor-patient relationship. And her frustrations with the traditional medical system inspired her to open BREATHeMD here in River Oaks, Houston, with the goal to simplify the whole patient experiences around visits. I think that's where we share that common goal of trying to empower patients with a better healthcare experience and move away from a traditional insurance-based model of care. Dr. Bowden's also interested in research, and she's currently working with physicians at Methodist to publish her findings from the recent COVID-19 testing. So I'm ready to dive in. I have a whole lot of questions, but Dr. Bowden, thank you for accepting this.
I'm very honored to be here. So thank you very much, Aanchal.
So give us a little bit of the backstory. You've taken this huge entrepreneurial jump, and your model is very unique. Mm-hmm. What you're doing at BREATHeMD is special. Mm-hmm. And you know the title of my book. It's right. Your Doctor's Not God. And I really feel you're one of those physicians who is not that God doctor. and you're very empathetic to the challenges people face in navigating healthcare, and you've provided a lot of services under one roof. Mm-hmm. So tell some of our listeners today about what brought about BREATHeMD and what you're doing there.
Well, thank you. So I'm a mother of 4 boys.
Right.
And I was basically pregnant for 5 years. It was almost 5 years straight, which means I was at the doctor's office, I don't know, 6, I can't even count, but countless number of times in that 5 years. And it entailed going down to the medical center, wrestling with the parking garage, going up 8 stories to find the space, going down one elevator, crossing over, going up another elevator, walking, then I check in, then I sit there for 2 hours with no one talking to me. And I love my doctor, thank God, but it just wrecked my day. And I wasn't sure if I was going to go back to medicine because with 4 boys, it's very challenging to do anything outside the home. But I finally came to the realization that they're growing up and they don't always need me as much as I thought they did. And so I decided I wanted to go back to work, but I wanted to do something that I could run and that would be something different from what's the typical physician's office visit. And that entails step 1 is great parking. Like our office is ground level parking. We have about to have 2 reserved parking spaces. We only have 1 now, but we're expanding. So reserved parking, and you just walk right in, and the waiting room is tiny because you're not going to wait. You're going to be ushered right into into the office space, into the clinic room. And then, you can schedule it online, and if you need a test, you can have it done in the office. And, we have a CT scanner, we have allergy testing, we have somebody that can draw blood. We have home sleep tests if you need a home sleep test. We're about to have an overnight sleep lab if you need an overnight sleep test. So we try to get everything right there that you would need, and so you don't have to go to LabCorp or go to the imaging center or, go somewhere else to get an answer to what the problem is.
And typical ENT offices are just based around the physician and around insurance, and it's very prescriptive, right?
Right. And I offer ancillary services that I think complement the physician care. And one of those is sinus therapy, and it's based on what we do for patients with cystic fibrosis who can't clear the secretions from their lungs. But this is geared towards the sinuses, and it's a saline wash, but it's powered. It's got a pressurized saline that goes in the nose, and then we have a pretty powerful suction.
Right.
So you spray in one side and suction on the other side, and it really drains the mucus. It gets all that stuff out. And then we also...
It's pretty cool. I mean, I saw it when I came to your office, and I mentioned that we have something in Ayurveda called Jalneti, where we do the manual version of it.
Right.
But it's unique. I'd never seen something like that.
Well, people used to do it, and the old school ENTs used to do it, and then I don't know, during my training, no one ever did it for some reason.
The sinus can be very painful, and I think if they can get some sort of relief from getting this drainage treatment, it's pretty cool.
And saline irrigations are standard of care. I mean, before you have sinus surgery, one of the requirements is that you have tried saline sinus rinses at home twice a day. So it's definitely mainstream. It's not something that insurance will pay for, at least not yet, because
maybe that explains why it went out of fashion.
Maybe I don't know why. It's weird to me because we have the equipment to do it. Most ENTs would have the equipment to do it. And
what about the infrared rooms? Do they also help with the sinus?
Yes. I mean, I'm going to get research done on it. So it's not proven to help with sinuses, but it is proven. It's called photobiomodulation. And if you look up photobiomodulation, which is infrared, there's just so many applications. It just hasn't been studied for sinuses, but it's the basic gist of it is it lowers your inflammation and it increases circulation, which is good for any kind of infection, right? So infection causes inflammation, and then the more circulation and blood flow you can get to the area, the faster you will heal. So it's, but I can't claim that it cures sinus disease yet, but it's people can tell me anecdotally that it really helps.
So what are the kind of things that people should come to you for? Like a lot of us only go to an ENT specialist when we fall sick, or if we think we have an earache, or if we have some issue. What are some of the things that we can come to you for just therapeutic relief or prevention? Because the sinus irrigation is great. If you're feeling all stuffed up and you're in pain, we can come to you.
Right.
For inflammation, infrared therapy, for all the massages that your center offers. That's great. The lymphatic drainage.
Oh, and we have lymphatic drainage, yes. Some things that you might not think of, we do ear cleaning. So those are some of our most satisfied patients.
Should we go to an ENT to get our ears cleaned regularly?
It's weird, and there's no way to know if you actually have it. I do offer just a quick ear check appointment in case people can usually tell if they've got a buildup, and people who have an issue with it usually know, but some people don't. Like I had a patient a couple weeks ago who just said, I feel like there's something in my ear, and then we flushed out just a golf-sized ball of wax, and it was so. And those are very gratifying. That's very gratifying for me, and very satisfying for the patient. So earwax is one of those things. I think paying more. I think people really, it's funny. I read something that Americans spend like billions of dollars on helping them, on solutions to sleep, but yet no one can sleep well. Like
True.
Getting the great night's sleep is like the holy grail of health. I think
it's a foundation. I mean, all our patients get the Oura ring for that reason. And
so I think in ENTs, we do most sleep problems are upper airway related, and it could be as simple as just making sure you can breathe through your nose properly. And, the other element is your weight. So, the more weight you put on, the more likely you're going to have excess tissue in your upper airway, and then that leads to sleep apnea. So I think that's a huge area of prevention is, just keeping your weight under control, but making sure that you're not just dismissing your sleep, it's putting sleep as a priority.
It's interesting that you look at the whole body, and you will sit and talk to your patient about their weight, and not just diagnose them with sleep apnea and give them their treatment and move on.
No, and the other thing that I do that most ENTs don't do is, because I'm board certified in sleep medicine, so I follow the whole sleep. I don't just, most ENTs don't read sleep studies or, manage insomnia or manage other sleep disorders, or really even, they'll operate on patients with sleep apnea, but they don't do much beyond that. So I can do the whole comprehensive evaluation of a patient that has sleep issues.
Which brings me to my next question. Sleep apnea is, I think, almost everybody in their household has a family member they know who is suffering from sleep apnea. Yet there's a lot of stigma around it to get the diagnosis. The spouse is the one who will know that they snore, and that's a big symptom.
Yes.
But if you can educate our listeners about what is sleep apnea and what's the latest, greatest out there for sleep apnea, and, maybe demystify it a little bit.
It's very common. It probably affects, they estimate 20 to 30% of the population. It is basically a periodic, repeated collapse of your airway when you're sleeping. So there are different types of apnea, but I'm just going to talk obstructive sleep apnea because that's the most common. And it's, basically the tissues, it comes from the back of your tongue, the soft palate, and the back of your throat all meeting. And they just basically, it just closes off while you're sleeping. What that does, your body goes into alert mode, and it keeps you, so the deeper you sleep, the more likely you are to obstruct. So you end up not getting the deep sleep that you need because your body, it's a protective mechanism.
Right.
So your body's keeping you light so that you don't get too deep, so you can continue to breathe because breathing is important. And then, so that happens, it ranges. It could be 15 times an hour. It could be 60 times an hour. It could be 100 times an hour. And with it, the oxygen level typically drops in your bloodstream. And with the lack of oxygen and the lack of deep sleep, it's just very hard on your body long term. I mean, it's been associated with increased risk of hypertension, increased risk of heart disease. It's equated, somebody with untreated sleep apnea is just as dangerous behind the wheel as somebody that's been drinking.
Wow.
Yeah. So it's more serious than people realize. And I'm not an alarmist. I hate but I feel like people, and once it's treated, people feel so much better. Yeah. The testing has really come a long way. We still do the overnight sleep studies for some people, but the majority of people can just go home with a device that you wear on your wrist. It has a little string that goes to your finger, and then one little string that goes right here. So there's nothing up here, and it's just one night, and it's very accurate. And
they can do it on their own. They don't need somebody sitting in their room watching them.
No, you do it at your house. It's insurance approved if you haven't, It's really not a big deal to get diagnosed.
Back in the day when we took my father-in-law for a sleep study, we had to go to the hospital
Yes.
and we had to be in this terrible room, and there was a technician in the room the whole night.
Yeah, so I'm building out a sleep lab,
Right.
and it's going to be like the 4 seasons of a sleep lab. So you
Fabulous.
feel like you're at a nice hotel room. I'm
Right.
even going to provide a little alcohol if that's part of your nightly routine.
Uh-huh.
Yeah, you'll get a TV and
Because you also want the accurate picture. If they are used to having a drink,
in their normal.
then-
Yeah, they can't.
Yeah, maybe they can come to Sydenham Clinic for happy hour and then go to
Well,
you.
and we want them to they could get a massage before the
Right.
sleep study to relax. They can sit in the infrared sauna before the sleep study to just chill out. So I'm trying to make the whole
Are they allowed
study.
to bring a spouse along and sleep?
Actually, yeah, that wouldn't be a problem.
Yeah, because if they're used to having somebody.
Yeah, that wouldn't be a problem at all.
Yeah,
So-
their date night.
Well, yeah.
At BREATHeMd.
They are on camera, so
Oh.
there's gotta be,
Maybe not.
fully clothed at all times,
Yeah.
please.
Well, that's very helpful. That is definitely helpful. And I hope some of you listening out there will take that step and at least get a diagnosis, because it is serious. It is serious, and you can stop the suffering from what it sounds
and
like.
it's so hard on a marriage if
Yes.
your spouse is keeping you up all night, and they've shown that it's the marital conflict alone is just pretty.
so it's
I can
damage-
speak from personal experience. Like, you don't want to sleep in the same bed with somebody
Yeah.
that's keeping you up all night.
I know so many people who sleep in separate bedrooms
Right.
because one spouse snores.
Exactly.
So it is serious. I'm so glad that you brought up some of these, because it has an emotional impact. It is dangerous to others.
Right.
It makes you put on weight. It puts
Right.
you at high risk for so many other conditions.
Right.
And it's worth it. It's
Right.
worth it, if not just for your quality of sleep. I think there are many reasons for people to do this.
Yeah.
I also want to talk to you about sinus. A lot of people go through their whole life living with sinus, and they feel that there is no cure for sinus. What can people do? I'm very passionate about empowering people to be the CEO of their
biggest
health.
thing you can do is rinse your nose at home with saline. I don't own any stock in NeilMed, but the NeilMed sinus rinse bottle, it's a game changer. And if you do that regularly, because basically you need to keep everything flowing in your sinuses. And sometimes, I tell people who have allergies and take antihistamines every day, maybe go to every other day if you can, because it's very drying and then the mucus gets stuck. And you just want to keep everything flowing. And as long as it's flowing, then you're going to have minimal issues. It's when it doesn't flow right. And there could be underlying anatomy and there are, I'm not anti-surgery, because there's certainly, but I think there's probably too much surgery going on. I remember during residency, one of my attendings was a sinus guru. I just saw people that had like 6 sinus surgeries. I'm like, what else is left to do? So I just think a lot of it is managing, our air quality is
Well, I'm from
probably
New Delhi. You
yes.
can't complain.
Well, no, I'm just saying that people don't think about that.
Yes.
You're inhaling whatever's floating around
Right.
is
the
going
toxins
in
the
your
air.
nose, and then the allergies cause swelling. It can be hormonal imbalances. Like people who are pregnant have a really hard time because their noses the inside of their noses swell so much. So I'm not anti-surgery, but I think there's a lot. If patients, it's almost like brushing your teeth. If you could just rinse your nose, you brush your teeth, rinse your nose. It doesn't take long. You just get in the habit of doing that.
And what about pain medication, that side of managing sinus when you get that attack?
Well, I have never, ever needed to prescribe anything more than like Advil. But yeah, I'm a big fan of those little Sudafeds, the little red pills that you have to show your driver's license for. They're not great if you have high blood pressure, but for a short-term fix, they basically shrink the tissue inside your nose. So they help open it up. That's usually what I recommend people do. And then doing the sinus rinses can help too. And the more salt you add, the more of a decongestant effect it will have. So you could add extra salt to.
Great. That is great to know. And I think the hottest topic these days, and something that you've been doing a lot, you've been seeing a lot of COVID patients.
Yes.
You've probably tested more than 4,000 COVID patients.
7,000.
7,000, wow. I mean, I think that you must have had the maximum number of privately tested COVID patients in Houston.
I don't know.
But you have a few hunches, or you have your own private position on COVID and learnings. And I think our listeners would love to know what that is. Even though it's not proved, nothing in COVID is proved because it's so new. A whole
Right,
phenomena
I
is so
know.
new.
Don't attack me if like a week later this is all wrong. But
no, not at all.
Yeah, I think the most interesting thing I've seen is that I've tested a lot of families, and invariably one or two of the people in the family get it and one or two of the people don't get it.
Right.
And what's the explanation for that? And the most valid explanation I can come up with is the T cell immunity theory, where you have become, you have the immunity against corona from either a very low level infection that's not, you can't detect a T cell infection with just a regular blood draw. So it's either you had an asymptomatic infection or you had something very similar to what's going on now that's protecting you against this whole recent pandemic.
But can you see it in the antibodies, or how do you test for it?
So the antibody, the blood test, so we do a blood test for antibodies, but that's a B cell immunity phenomenon. That's a different, they're two wings of that system. There's T cell and B cell. And so the B cell immunity we can measure with the antibodies, but the T cell immunity is very difficult for just a routine test. So personally, I think, because I mean, I should be dead right now given how much exposure to COVID I've had, and I never got it, and I've been tested, multiple times. I don't even have the antibodies, and I just think it's very interesting. And I know there's a blood type theory, and we're looking at that. We've collected
what could that
data.
be? Give us a sneak peek. Who's the lucky one?
No, well,
it
they
B?
think
Is it
that the type O negative is the lucky one,
and that's the common,
negative.
and that's the most common blood type.
No,
is it?
that's the rare one.
Oh, that's
because you're
the
a
rare.
universal. You can give
B
blood.
is the most common.
One of the probably. I don't, but
okay.
I'm O negative, so I only know about O negative basically.
Right.
But it's it's the more rare type, and they think that people with O negative. But I have seen people with O negative who have COVID, so
Right.
I don't know. I really need to look at the data before I say anything definitive on that.
And what do you think is the future of ENT medicine? Do you think a lot of people are going to follow suit and be more holistic in their approach to healthcare like you are? I mean, which direction are you going in, and where do you think mainstream science is going?
I don't know, because as far as I know, I'm the only clinic in the country that offers these types of services for ENT patients. And it's pretty, old school. At least my residency experience was very, very traditional and very male dominated. Yeah. Nothing against the males, but just, very old school, traditional. I'm not sure. I hope it would be nice,
we're trying to create a new paradigm for primary care. We're trying to create a new paradigm here for personalized medicine.
Right.
And we're hoping that we'll change the game. And I really hope for you that you change the game as well for ENT, because there's so many people suffering from sleep disorders, so many people suffering from sinus, so many people who could benefit from avoiding surgery, from avoiding that traditional mindset of just treating the disease or treating ENT as that subsection of a human body.
Right.
And I'm so happy to learn that you are treating the whole person.
Yeah.
I'll come to my last question.
Okay.
I would love to know a little bit about your personal health care. How do you take care of yourself and self-care? And if you can share with all our listeners what your secret sutra is.
Yes. Okay. Well, part of my exercise is taking care of 4 boys. So I consider that that counts a little bit.
A lot.
And then I really try to do Pilates on a reformer. I love that because I have scoliosis, and I love and I'm going to offer this in my new center because I just love the reformer Pilates because it treats your whole body. It's stretch and strength. And I get chronic pain in my hip, but if I do my Pilates, it totally, completely fixes the problem. So that's sort of how I try to watch everything in moderation is probably one of my little, life's too short to go extreme on anything. So I try to exercise when I can. I try to eat right when I can, but I don't beat myself up if it doesn't work out.
Well, you look great. Whatever you do is definitely working.
Well,
so your secret sutra is meditation, is moderation.
Moderation. And
Pilates.
Then in terms of the psychology, it's always been happiness is reality minus expectations, which sounds kind of cynical, but I am a little cynical. But it's just basically keep your expectations in line. I mean, and I have a growth mindset, but I don't expect too much from people the people I love. I don't, I just, like my kids, they drive me crazy.
Yeah.
But I also have to keep in mind, they are kids and one day they will be men.
So you're not a tiger mom.
Oh no.
No?
I'm the opposite. I'm proud. I should be more tiger mom, actually. It's something I'm working on.
Well,
but
I stalked you on Facebook and your kids look great.
They're crazy.
They look really great. I mean, whatever you're doing is working.
I don't know. I don't know. We'll see. We won't know. Talk to me in 10 years.
So I think that's a great tip. I mean, that's how you've been seen with 4 kids is moderation.
Well, they beat you down.
You
you can't. If I had one, I'd probably be a super tiger mom. But with 4, you get beaten down to the point where you really can't. You realize there's limitations on what you can achieve. So.
Okay. I'm sure it's very satisfying. I mean, just being a mom, I'm very happy. I'm a mom of 2, so you're doing double of what I'm doing. But great, thank you so much. And I think this was a very informative session. Life Sutras is trying to bring in more conversations like this and empower people. As I always say, health is by choice, not by chance. I hopefully have given you more choices today. And if people want to reach out to you, it's BREATHeMD, and the website is breathemd.com.
.org.
BreathEmd.org. And you're right here in the River Oaks area next to Kato Robata, which is a fabulous Japanese restaurant. And you're on the right and left of Kato Robata. You have 2 spots there.
Yes, trapping.
But until our next episode, thank you so much for joining us. Stay tuned in for more. And we'll see you next Monday.